So I'm introducing first to you from Abunda Foods, a friend of mine for a long time. His name is Peter Leighton. Peter used to be from Salt Lake City, now down in my hometown in San Francisco. And he's been working on a project for quite some time in the probiotic health space with a product called Mojo Milk. And I think it's an incredible product. It's a powdered product in a stick pack form. And I haven't seen his presentation yet, so he may be presenting things that I'm not even aware of today. But I think it's a very, very cool product and a great delivery system, particularly for kids. So, Peter, with that, take it away.
Thanks, Jim. I wanted to give an introduction to what we're going to be talking about, which is gut health beverages. And I want to give first a little overview, a little history of functional beverages as a whole. And hopefully this will work. So the history of food, let's start from the beginning. We started by looking at food as a survival mechanism by caloric intake. We went to developing food as a formation for family, to create satiety, and basically it's all about taste and togetherness. And what we've moved towards is this area of functionality, of looking at foods to enhance our lifestyle, which is what we're going to be focusing on today. But in the future, just to give an eye out to what's around the corner, we can look at food as an optimization of our life with things like nutrigenomics. And if you haven't heard of that, keep an eye out on the future. What I call malnutrition of affluence, it's the fact that as we've become more affluent as a society, we're actually less nutritious. It used to be the parody of a wealthy individual was a very heavy-set guy, if you remember Monopoly money. And the interesting thing is that our diet initially was one that was calorie-rich and nutrient-rich. And we had such biodiversity in our diet. We ate from so many species of plants. And we also got a significant amount of exercise. But over time, and particularly in post-industrial society, what we've done is we've moved to a diet that's very high in calories, but in fact is very poor in nutrients. We have a lack of biodiversity in the diet, and of course, as you know, we all get less exercise than we'd like to. So the state of our food right now is this processed foods, because it's all about the food delivery system. It's about getting food to the table. We're the breadbasket of the world. And so in order to do that, we have to create production, which is processed foods. And what we're doing and what we have done is depleted the nutrients that are normally found in foods. So the quality and the diversity is gone. Post-industrial agricultural and food processing has essentially stripped out these phytonutrients that we never knew were important to us. But you hear about polyphenols and you hear of these antioxidants, all these things that we never knew about, but now we do. And we realize that these things have been taken out or selectively bred out of our foods because they don't taste good. We used to eat from hundreds of plants, and essentially now most Americans eat 3 vegetables: French fries, ketchup, and iceberg lettuce. And that's a fact. So studies are showing now that this relationship between what we eat in our Western diet and chronic disease is more profound than ever. And what we've done is we've supplanted our food quality concerns with consequences in the quality of our diet. So processed foods, again, when you look at the facts, 90% of money that Americans are paying for food is going into processed foods. 10,000 new processed food products are introduced every year in the United States. And these contain lower levels of antioxidants and other phytonutrients, which are very important for us. So this leads us right into this area of functional foods. And functional foods as a general category is hitting on the sweet spot of what we're going to be talking about today, which is gut health. But bear with me one more minute. What's happened is people are recognizing the deficiencies that we're having, and they're recognizing that they can take an active role in managing their health through their diet. And so what's happened now between the knowledge that we have in food science and our ability to make changes, it's leading us into this new era of functional foods. So you may say, well, what are functional foods? And everybody asks that question, and everyone's looking for a very specific answer. And I'm going to give you a general one. I'm going to say that there's three general types of functional foods. There's those that are inherently healthy. And I use the example here of grape juice. So an inherently healthy functional food product is one that is made from or contains a natural bioactive ingredient, such as grapes, because they have polyphenols and other benefits. The next class of functional foods are these bioactive added. And those are a naturally healthy product per se, but one that is enriched or enhanced with a bioactive ingredient for a specific health function. And where the market has actually been going is these more engineered products. And I use Red Bull as an example because it is formulated specifically to achieve a functional benefit. So that is, in fact, a functional food. And when you look at the spectrum of functional foods, and again here I'm focusing on beverages, on the one end where you can say it's definitively a food product, to the other end where it's more medicinal, there's a whole host of products. The nutritious products, the enriched, the enhanced, the engineered, those that are designed for wellness, and those that are designed for functional or semi-therapeutic benefit. So now, this leads us into the gut health market, which is where we want to focus today. 70 million adults suffer from digestive problems in America alone. You see these commercials all the time for the therapeutics on the marketplace. It is an epidemic. And it's an epidemic partly because of what we spoke about earlier, which is this processed foods and the way that we're living our lifestyles. 1 in 7 people will suffer a chronic gastrointestinal disorder. And 76 million people will get a foodborne illness in the U.S., and 40 million people will suffer from traveler's diarrhea. So that should indicate to you the propensity for this type of gut health problem. Well, why probiotics? Why are probiotics one of the key things that we've heard about, and why is it doing so well? Well, it represents one of the fastest growing sectors in functional foods. The global volume of consumption is 3 times greater than omega-3, which you probably hear of all the time. It is really the most successful functional ingredient on the marketplace. The global market is estimated at about $28 billion, and it's expected to reach about $45 billion, and it is continuing to grow at a very high rate. Probiotic supplements, they only account for about 6% of the supplement sales in the marketplace, but it's $2.3 billion, and it outstrips soy, which has been around a while and was one of the keynote products in the supplement marketplace. In the U.S., per capita spending on probiotic supplements is expected to double very soon. But the lion's share of probiotic sales is really occurring in the food sector, and specifically in beverages. Sales of probiotic-containing foods grew 31.5%, and it's continuing at a very fast pace. North America alone has seen tremendous growth. And to give you an indication, this kind of breaks out some of the key food sectors that are leading with probiotics. And you can see that obviously baby products are very key among them, which should tell you something about how people are viewing probiotics as a very safe, efficacious, and something that is being ingrained in society. And of course, beverages, 28%. So consumer interest in probiotics is measured by Google, which, interestingly enough, I heard on NPR this morning, somebody just written a book about analytics and how they're being used. Google can give you real-time information about trends in the marketplace. So it's multiplied by a factor of 3 since 2004. The term probiotics grew in awareness just between 2002 and 2009, which is prior to it getting to a large state, by 567%. So again, it should give you an indication that probiotics is a very solid and high growth segment. 81% of Americans rank probiotics as the most important nutrient in a 2011 IFIC survey. And 57% of shoppers say they want to learn more about it. So let's take a quick look at probiotic beverages and some examples. And then I'm going to lead you right into Mike Bush, who will talk to you about formulatory issues and some of the probiotic specifics. One of the early entrants into the world of probiotic beverages was a product called Yakult. It was launched about 75 years ago in Japan, and they would have these door-to-door salesmen, actually they were women, who would go around selling these, what they call the daily shots. And it's a cultured probiotic product in a very small container. It has just recently been proliferating here in the United States, which is one of the last countries to see Yakult come into the marketplace. And they sell over 52 million bottles a year in the U.S. already, and they really have only been in the marketplace a couple years. And they use a proprietary strain of probiotic, which was developed by their founder. Another very interesting case is a product called Proviva, which uses the Probi product, which is a phenomenal and well-researched probiotic. This product has done exceptionally well. I think it's only 2 key European markets, and it was doing about $50 million in sales, which is pretty astronomical. It was launched in '94. It uses the LP299V, and Danone has acquired an equity interest in the company, which should tell you about where that's going. In the U.S., after seeing the success of Proviva, a company called Next Food developed GoodBelly. And GoodBelly is, again, it's a fruit-flavored beverage. This is done in more of a shot version than the larger containers. It was launched in 2006. It uses the same Probi strain, the 299V, and it also includes vitamins. It delivers about 20 billion CFU, colony-forming units, per serving. Here's an example of another format besides a cultured milk-based product, besides a fruit-based beverage. This is a powdered stick pack called Pre. It essentially has a blend of several different strains of probiotics, 2.5 billion CFU per serving. It delivers 20 calories per stick pack. It's essentially a fruit flavoring, and it also contains a prebiotic in the form of inulin. This is the product that we have done test marketing in for the past few years. It's called Mojo Milk. It is a stick pack as well. It is. We looked at the marketplace and we said, gee, we want kids to drink healthier. Milk is essentially, arguably, a very good beverage in the form of delivering a lot of nutrients. But kids only like milk if they put all the sugar in it. How can we make a better milk? And it took years to be able to find a strain that we felt comfortable would remain stable in a liquid form, that would remain stable on the shelf. We used the Canedenie BC30. We put 2 billion CFU per serving. It is a all-natural, low-calorie based powdered milk mix. Kavita is another brand. This is an RTD, and this is really a sparkling beverage. This uses also the Canedenie BC30. They use several other strains as well, so they do a blended strain. Again, 20 calories per serving here, and they're delivering 4 billion CFU. So what I'm trying to give you is kind of an overview of some of the beverages that have hit the market in various forms. And now I want to talk just briefly about some of the keys to being successful, what you need to be able to look at in order to compete in the marketplace. One of the most important things, and I call this the 4 keys. Number 1, it has to be an experiential product. It has to deliver on taste, perception. It has to be able to have an experience of some sort. Second, it has to be safe. So you have to mitigate risk. You have to use science and a well-validated strain. It must also be intuitive, recognizable. It can't be something so bizarre or unusual that you're changing behaviors, because people don't do that very easily. And finally, again, it must be endorsed or validated by key stakeholders. One thing that's very important is that I've seen a lot of functional food products, a lot of functional beverages, and in fact some probiotics who try and be a therapeutic. And I will tell you that the most successful functional products provide a wellness benefit. They're not trying to masquerade as a therapeutic. Don't go there. Consumers don't want to eat from their medicine cabinets. They want to rely on science for a validation, not as the primary selling point. For serious health conditions, remember, consumers have options that are therapeutic, that are reimbursed by insurance. Consumers need drugs but they want foods. It has to deliver on the food benefits of taste and convenience, and let the selling proposition secondarily be that it's healthy for you. Again, consumers eat to enjoy. Everything else is secondary. And if you get away from that and you're dealing with any type of functional product, any kind of gut health beverage, you're going to be off base. Deliver a lifestyle solution, not a medicine. Most of the successes in this category have created new subsegments. They also have built new brands, interestingly enough, and not necessarily line extensions from major companies. And there have been many major food companies who have tried and endeavored to get into functional foods and beverages, and they failed. In order to be successful, you'll find that the successful products provide a high level of convenience. And bottom line is taste. With that, what I'd like to do is I'd like to hand this off to Mike Bush, who will give you some insights into the probiotics themselves. Mike?
So this is Mike Bush, obviously, from Canedenie, and I'm not even sure, I haven't seen your presentation yet, so I know you're talking about gut health, but I'm not sure exactly what you're talking about in gut health. So
formulating gut health beverages.
Beautiful. Thank you, sir.
All right, so once again, I'm Mike Bush from Canedenie Biotech. To talk, we were in the gut health business for a long time. Canedenie was founded back in '97, and we had a line of supplements and medical foods that were geared towards specific gut health issues, IBS, chronic constipation, gas, Crohn's and colitis, and a variety of others, lactose intolerance. I'm a little bit more optimistic on the size of the market. I go for 100 million Americans suffer from some sort of digestive distress over the course of a year. But, the gut's really more than just the gut. When we talk to consumers and you say, tell us about gut health, and they'll tell you, maybe they'll say constipation, diarrhea, gas, bloating, but a lot of them think that the gut stops at the stomach, which is obviously not true. But the fact is that consumers don't understand gut health. They really don't understand the correlation between the immune cells in the gut and gut health. They also really don't understand inflammatory processes that all begin in the gut. And research is starting to show a really strong correlation between gut health and brain health. They're calling it your second brain. There's lots of correlation between the metabolite or the metabolic processes that convert, for example, tryptophan to serotonin, and there's all kinds of neat stuff going on. There's also issues relating to lifestyle choices that cause issues with the gut. Processed foods, as Peter said, the most consumed vegetable in the U.S. right now is ketchup, and it's being quickly overtaken by salsa. So we're starting to see that consumers, as you said, the more money consumers have, the more they eat out, the more they eat processed foods. Antibiotics. Just as a quick aside, I was at a conference not too long ago, and they talked about how long it takes your immune system to get back to normal once you've had a standard round of antibiotics, and they're talking gene expression and some other things. It typically takes, if you take a Z-Pak, for example, it takes about a year for your immune system to begin functioning correctly. If you have something like a super antibiotic, like a Cipro or something along those lines, it can take anywhere from 2 years to, if ever, to get your gut back to normal. The average person in the U.S. takes an antibiotic every year, so functionally, your immune system never properly functions. You're never expressing the genes appropriately. Obviously, your immune system continues to work, but it doesn't work as effectively as it does because you never get the chance to recolonize the gut effectively. Lack of sleep, using antibacterial cutting boards and hand sanitizers and things like that all screw with our guts. So, what is it that we can do to produce, create a healthier environment in your gut? As we say, let grandma know that the oatmeal is passé, although my grandmother did say that oatmeal is the healthiest thing in the world. No matter what you did and no matter what you had, oatmeal or chicken soup could pretty much cure any disease that was happening in our household. But the nice thing about beverages and formulating for gut health is it allows a quick, convenient, pleasing, good tasting option for people that they can take with them on the go or they can consume quickly at home. There's a broad ingredient and functionality profile, and there's a virtually limitless number of options for gut health products. You can have shelf-stable, refrigerated options. Drink mixes obviously offer even more options when it comes to convenience. You just carry a stick pack with you, throw it in your milk or in your water, and away you go. As I said, there's this huge body of growing evidence for supportive ingredients into gut health products. Anywhere from cayenne pepper to aloe to everything else. We're starting to see a lot of work around botanicals and teas and things like that that have gut health benefit anywhere from marshmallow to you name it. There's lots and lots of things going on. The two things I think that people think of right off the top of their head is gut health. If I'm having stomach problems, yogurt, probiotics, prebiotics, fiber. But there's a lot of research going on around those areas. The big challenge is how do you get those products or those ingredients into your product, into a finished form to maintain activity. Formulation considerations, you really need to look at the age, gender, ethnicity, and the market of the consumer. If your goal is to take over the world with your functional beverage and you decide that you want to have the aloe, cayenne pepper, refrigerated beverage, you're probably going to miss part of the market. Then again, that may be a segment of the market that you want. If you're looking for a kid's product or a product that moms are going to give to kids, you obviously need to formulate it accordingly to the kid's palate. Same thing with ethnicity. Some of the things that we're seeing going on in some of the ethnic markets, which, by the way, are huge. If you look at just in the U.S., the Hispanic market, for example, is massive and growing. The Hispanics in California have more purchasing power than the entire country of Canada. So there's a lot of things going on. So these specialty formulations for ethnic groups are exceptionally important, especially in this space. You have to consider your desired shelf life. Is this a 3-month juice product? Is it a fresh product? We're working with a dairy in Europe right now, and they have a 10-day dating on their milk. And so formulating a product for that fresh 10-day milk versus an aseptically packed milk that's sold in Latin America are completely different things. And your options for functional ingredients change. You also need to look at your distribution system. If you have a refrigerated product or a product that needs to be refrigerated, you need to make sure from the time it comes off your line to the time that it makes it to the consumer that it's in a refrigerated format. And we do see on occasion, just in our business, folks that are kind of skipping a step somewhere in that refrigeration distribution system, and it causes issues with the active ingredients. And you also need to look at specialty formats. If you look at teas, for example, there's all kinds of formats for teas, whether it's hot or iced tea. There's all kinds of specialty formats. We're going to do some work this week with a group called Unistraw that's launching a new flavor straw here at the show. So there's some really neat specialty formats that you can use to formulate a really great beverage that's unique. Some of the novel ingredient delivery systems that we're seeing, as I said, the straw, they can incorporate some really neat actives into a straw that allows you to deliver those actives over the course of one 8-ounce or 12-ounce beverage, releasing the actives, and the actives are exceptionally stable throughout the entire time. It's a really neat process how they make the beadlets, and if you get a chance, we have no interest in some of the things that they do, but it's a really cool technology that they use. Same thing with dispenser caps. I was just pulled aside on the way in the door with somebody asking me, have you heard about such and such dispenser cap company? Dispenser caps, BioGaia makes a nice dispenser cap. There's a lot of different dispenser cap companies with price ranges from anywhere from 5 to 8 cents all the way up into the 60 to 70 cents per cap range. And we're starting to see some things. There's a company that just launched a dispenser cap that's actually a pressurized cap. So when you pop it open, it actually shoots the material down into your beverage. Hansen has one for probiotics. There's a number of dispenser caps on the market. And stick packs, once again, through some of the new technologies that you have, you can agglomerate and do all kinds of neat things with your powders so that it disperses real well. It's highly stable. You can have your active ingredients in there, so you're actually providing a real benefit to the gut of the person who's consuming that product. So when we talk about formulation do's and don'ts, make sure you're vetting your ingredients. I can't stress that enough. I'm sure that you all know that there's great ingredient providers and there's not so great ingredient providers. There's places that make great ingredients, and then there's places that make generic knockoffs of things that aren't exactly what you're buying. So the first question you have to ask yourself is, okay, I've picked these ingredients. Is this particular ingredient grass? And one of the little things that we're starting to see in the industry pop up more and more is you'll see grass levels. Let's just say when we're talking probiotics, you'll see a grass level that may be 100 million or 250 million CFU per day. So that says their safety experts have said 250 million CFU per day is the most you want to put into that a consumer wants to consume on an ongoing basis. Their clinical studies, on the other hand, may show that they need 10 billion or 5 billion CFU in order for the product to be effective. So you may be able to put it into your food, or your beverage, but if you want it to do anything, if you want to have any benefits to the person consuming this product, it's not safe at the efficacious levels. We're seeing that with lots and lots of different ingredients where people are hurrying up to get GRAS status so that they can get around NDIs, but their GRAS status does not cover them for the same level that they're seeing in their clinical trials. The other question is if you're going to make claims around some gut health beverage, it would be great to be able to have clinical data to support those claims. And you want to make sure it's peer-reviewed, great clinical data. The bigger and the better. And softer claims are better. What we're seeing is that with the rash of class action suits that we're seeing throughout the U.S., in particular California, New Jersey, Florida, you need to make sure that your claims are supported, but also the bigger the company, obviously the bigger the target, and so softer claims are better. And we could do a whole regulatory talk, but softer claims, for example, if you're doing a probiotic, saying that it's probiotic is now resonating more with consumers than specifically saying gut health or immune health. So just saying it's probiotic is understood that there's a health benefit there, which is why EFSA is having such trouble with probiotics in general. They're saying that the word probiotic is a de facto claim, so therefore you can't use the term anymore in the EU. As I said, you need to make sure that your inclusion rates are at a efficacious level if you want to make those claims and you want to support them. Branded ingredients, we're a branded ingredients provider, so go branded ingredients. But we do believe that branded ingredient companies typically are willing to invest behind that brand. And just in Canedenie, we've spent literally over $20 million since 1997 in safety and efficacy data. And that money doesn't just fall out of the trees. That's money that our investors have put in and that we've invested back into business so that we can support our clients, so that ultimately as they put products out there, we're able to give them published data and we're able to give them FDA GRAS status and things like that. Branded ingredient companies, as you walk through Ingredia, you'll see company after company after company that's investing significant R&D dollars that we as finished product companies sometimes don't see. We don't really realize that they're spending so much money on science. And really stability is key, especially in beverages, where obviously the high water activity of a beverage can certainly degrade the activity of active ingredients, and you need to make sure that you have stability data so that if your aunt buys this product and you're so proud of it and she drinks it on the last day of its shelf life, you want to make sure that the activity that you're expecting and the benefit to he or she that's consuming it will be there on the last day of shelf life. I can't more strongly stress the fact that there's so much pixie dusting going on in the industry where they're putting a little drib of this and a drab of that and calling it probiotic or calling it fiber. There's great ingredients out there that if you do your homework, you can find out. For example, on a prebiotic, we worked with a short-chain phos for a while, and that short-chain phos, you can make really good claims at 1 gram a day as compared to some other fibers where you need much more and they're much more difficult to formulate with. You just have to pick the right one and put the right amount in. You may be able to spread that across a couple of servings over the course of a day, but you need to make sure that the consumers are aware of the fact that in order to get the benefit that they're going to expect, that they need to have 2 drinks a day. Or if you load it into one, let them know that they'll receive that benefit at 1 drink a day. While at the same time, you need to keep your claims soft. So it's a tricky dance. Certainly don't make claims without supporting data. We see it all the time. I'm on the board of the IPA, International Probiotic Association, and we look at things constantly, and we see claims, very, very specific claims being made, and they're using the data from other strains, or they're using data from a conglomeration of strains, and they're trying to just say, this plus this must equal that, so let's make that claim. Make sure that you've got data to support your claims. And then last but not least, make sure you don't forget about logistics. We've seen it time and time again where people formulate a product and they decide, here we have it, it's great, it's stable, it's efficacious, it's ready to go, and how are we going to get it to the store? And so when you start looking at those, and they have it priced at a premium point because they've got all kinds of great branded functional ingredients in it, and then they realize that they've got to ship this stuff from Tallahassee to Seattle refrigerated the whole time, and it kills their ability to make margin. So you need to make sure that you're taking all those things into consideration during that formulation process. Just some examples, and some of these were touched upon by Peter. Kombucha, obviously, it's if you talk to some people, it's the miracle drink, and GT Kombucha is a huge player in this space, has huge market share. Teas, obviously, there's all kinds of functionality. There's teas with nutrition facts, there's teas with supplement facts, but there's tea is a nice place to put a functional ingredient. Obviously, he had mentioned Yakult. You saw a statistic on Yakult this morning. They're selling 30 million bottles a day now worldwide. That's a lot of bottles. There's the one in the middle is a cayenne drink. I just thought it was cute because I saw the cayenne. Aloe drinks, Kavita, as Peter had mentioned. And so there's some great functional beverages out there that are efficacious at the serving sizes that they're consumed, and they have got great functional ingredients in them. And they provide the benefit that people are expecting. And so I think that's kind of what we're looking for. And on that, we can take questions and go from there.
Thank you, Michael, very much. Questions? Questions on gut health. How's everybody feeling their gut right now?
What's a safe way to make a soft claim?
Once again, I'm not. Is this? Can you hear this? Okay.
Mic is on.
That better? There we go. So I'm not a regulatory person. I could recommend a whole bunch. But soft claims, if you're, for example, on probiotics, we see our customers, for example, they want to make really specific claims. We just had one not too long ago. We've done a number of C. diff studies. And they actually, this customer who will remain nameless, wanted to put shortens the duration of Clostridium difficile infections in healthcare. They wanted to put that on the package of a consumer product. And we're kind of like, first of all, that's maybe not a great idea. Second of all, it's probably against 700 different laws. But we said consumers understand that probiotics provide a benefit. Okay, so call it a probiotic product. If you want, and you want to make, if you have support, for example, with our organism, you can make digestive and immune claims at 1 billion CFU per day. So put 1 billion in, just say supports digestive and immune health, and leave it at that. You really don't need to go much beyond that, because otherwise you're just asking for trouble. We were hit with a class action suit last year, and it was just, it's the semantics that the class action attorneys are looking for, and so you're better safe than sorry.
Just what was that fiber you were mentioning?
So there was a fiber called Nutriflora. It's kind of changed hands a number of times, but it's a short-chain phos that, if I do recall, they were making digestive claims at 1 gram per day and immune claims and calcium claims at 3 grams per day. They're around. They'll be at the show. But it's real easy to work with. We liked it because at 1 gram a day you can actually make good claims. I think digestive and immune, I forget. It's been a while. But it mixes well, it suspends well, and so you can make your fiber claims and you can make your also functional claims.
So one of the things that Mike said during his talk, which I'm sure probably hit all of you the same way it did me, like a ton of bricks, is that by taking a Z-Pack or some kind of an antibiotic, your gut is anywhere from a year to never getting back to in its that's just an amazing. Why is that not all over health columns and things like that?
Well, I don't know if you've ever been in a pharmaceutical factory or a
Never,
pharmaceutical company. They're really good at keeping stuff out of the news. And it's similar to, babies obviously, they receive their initial inoculation of bacteria during delivery. So that data holds true. This is a total aside, so if you don't want to hear it, sorry. But so C-section babies have a 300% higher incidence of food allergies, eczema, and other things like that. The same thing with infants that receive antibiotics during the first 2 years of their life. They have a significantly higher incidence of food allergies and asthma and eczema and things like that. It's really important to, as a society, to try to get away from antibiotics on this chronic basis. It's just like we're trying to do with the livestock right now.
Mike, also, one thing I want to add to that, if you haven't been following the news lately, there's been reports about some of these superbugs, these resistant strains that are coming out. And it is starting to get a lot of play. And one of the things that's very interesting is that approximately 80% of the antibiotics that are used, that are manufactured, are used in animals. And they're used in animals for a whole host of reasons, one of which is to get them to market faster, healthier, and with more weight. What happens is that we consume those animals, and there's these resistant strains start on the farms, and they get into the hospitals, and we then overprescribe antibiotics, and it's, in my opinion, one of the big health crises that's around the corner.
Yeah, if you look at the incidence of C. diff, more people are dying from C. diff than prostate cancer and breast cancer, but the healthcare industry is completely in control of whether or not people get C. diff. Good hand washing eliminates C. diff and you lower your inclusion of antibiotics, but yet the healthcare industry in general is making sure that the C. diff, you see people with a lot of pink ribbons, but you don't see people with a lot of brown ribbons, who fight C. diff, and so it's just one of those things that antibiotics cause it.
Follow-up question on the Z-Packs and stuff. Is there published information about that recovery time?
Somewhere, yeah. It was at a conference a couple years ago in Rome where this was delivered, and literally it was 3 days of scientific conferences where there was a lot of snoring going on, and that one definitely had people on the edge of their seats.
Yeah, well, it certainly struck me, too. Any further questions for either Peter or, hey, Peter, I got a quick question for you. What else is in your Muscle Milk product? What other ingredients?
So Mojo Milk contains basically...
Sorry, Mojo Milk.
Yeah, we don't talk about Muscle Milk here. Basically, it contains cocoa powder. It contains a small amount of stevia, organic cane sugar. That's primarily what the ingredients are. So, again, the whole purpose of Mojo Milk was the idea of making a healthier Nesquik that gave a positive functional benefit.
So, thank you. I just learned something else from your speech today, Michael, that I used to consult with Unistraw. And do you know Tim York?
Oh, yeah.
Okay, so Tim and I worked together for quite some time, actually, in trying to sell the company. Mm-hmm. And I'm really happy to hear that apparently they're still doing some stuff in the U.S.
So they were acquired by a group in India, and they'll be launching this week, and it's we got our marketing managers here, and we got the mock-ups of their booth. It's fantastic. They are spending serious money behind manufacturing, marketing, and I think you'll all be impressed with what they're doing out on the show floor.
That is awesome. I always thought that straw was much bigger than just a kid's apparatus, and I think the delivery of probiotics in it is just absolutely awesome. So good for you.